Our last little video on the brain, we're going to look at what happens if your brain gets damaged and understand exactly what kind of functions of our brain have allowed us to be set apart from other species. Now, you may have heard people say that the brain is plastic. No one is saying that your brain is made out of plastic. Plastic is a property. It's the ability to change and be malleable. Okay? Your brain is able to reorganize itself and make new connections between neurons. Okay? That is happening all the time, but it happens most importantly at the beginning of your life. So the younger you are, the more connections your brain is making, and new ones. The older you get, the less that occurs. Other than age though, the environment plays a significant role. So when you're learning something new, then you are going to be making those new connections. So if you're always seeking out new learning, and that doesn't have to be academic learning, it could be learning new skills and sports, then your brain is adapting to that. It will also adapt if you get a brain injury and compensate for lost functions. Sometimes though, things go wrong in the brain. Okay? Brain injuries we can compensate for to a degree, but there are other things which are more debilitating. Epilepsy is one of them. Now that's a disorder of your central nervous system, and in particular what it means is that corpus callosum, there are erratic nerve impulses being sent through that. Okay? And it's disturbed, and what that causes is a seizure, which is basically the brain's going to overdrive and then it shuts down, which might be observed as someone falling to the ground and twitching, or it might just be that person appears to go blank and then they come back. Okay? We'll come back to that video in a minute. So how did humans take over the world? Well, we learned how to control fire, how to cook our food. We learned, therefore, how to consume more calories a day, spend more time socializing, learning. That helped us to grow bigger brains. Many, many more neurons, many more neural connections. Remember that increased in the surface area because it's wrinkly. And because we can continue to improve our access to highly calorific and nutritional food, yeah, we're not saying just have lots of junk, that's going to be good for your brain, it has to be nutritional, that means that your brains can actually be growing bigger still and developing better. We also now have the ability to do surgery in our brains, not our own brains, and we use medications to overcome things like epilepsy. Okay? There are also some dramatic ways of overcoming it. So if we go back to the epilepsy, if someone is having really severe epilepsy, such as multiple seizures a day, and multiple seizures which are preventing them from actually making new connections, what they will do, in some cases, is cut that corpus callosum. And that stops the spread of those nerve impulses and therefore stops the seizures. It also, of course, makes it harder for people to process information, so that's why it would only occur in the most severe of cases.
Parkinson's disease may present itself slowly, frequently starting with a slight tremor or a shake. In some cases, these symptoms can be so debilitating that patients find themselves unable to perform even the simplest of tasks. Reporter Brianna Venozzi meets a medical team employing innovative surgical techniques to combat the tremors, robbing some patients of their independence.
The tremors in 45-year-old John Leonard's hands and legs are so severe he's unable to work or drive. Side effects from the strong medications doctors in his native Arizona initially prescribed left his personal and financial life in ruins.
For the last month, he spent most of his time in his room because his legs shake so much, the tremors were so bad that he couldn't get comfortable.
He's what we call tremor dominant, early onset Parkinson's disease because he was diagnosed in his mid-30s.
It's one of the worst cases doctors at JFK Medical Center in Edison have ever seen. But today he's undergoing deep brain stimulation surgery, a procedure used to turn those tremors off.
So this is the lead that would connect to the microelectrode.
Dr. Asif Bashir and his team are inserting a thin, insulated wire called a lead. It's connected to another wire that monitors the activity of nerve cells and targets the signals that cause tremor and Parkinson's disease symptoms. The kicker? John is awake, but mildly sedated for the entire procedure.
So we are basically listening to the brain. As we pass from the thalamus into the deeper part of the brain, which is the subthalamus, the activity goes up, and Dr. Hannah and our team is able to track the waves over there, as well as we can listen to the activity.
They use an MRI and audio cues to locate the exact target in the brain where the nerve signals generate the symptoms. Listen closely. That rain on a tin roof sound is actually John's brain responding to the electrode.
We can hear the brain activity go up, telling us we're getting close to the target.
They'll send electrical impulses from a neurostimulator through the wire into the brain and block the signals causing the tremors.
It's very similar to a cardiac pacemaker, and it goes in the same area of the chest as a cardiac pacemaker. It's just about the same size.
Right now, doctors are fine-tuning and trying to find the appropriate balance between the highest voltage needed to turn the tremor off without causing a side effect.
That target is not resolving the tremor of the arm and the leg. So we're going to implant a second electrode in the same side of the brain at a different site that will get the tremor under control, and he will be able to reduce his medication significantly, if not completely.
Second time around, and they've got it.
How about if we turn it on again and take over the tremor? There we go. The prognosis is very good once you have the tremor under control. Then basically, as long as you keep on changing the generator every 4 or 5 years, all the motor symptoms are controlled for life.
It means it's not the end of the road for the young father of two, it's the start of a brand new one. In Edison, I'm Brianna Vanozzi, NJ TV News.